Now, very excited to be here today. I'm going to give it a few moments to allow our friends to join us here in the chat. As you do tune in, please just comment with your name, where you're watching from, the name of your pet, maybe if you have one there at home with you, so that we know you're with us. But we have a great conversation today. We'll introduce our experts here in just a moment once we know more folks are with us. Again, as you log on, just comment to let us know that you're here. But we're going to be talking about re-entry today, resuming visits, therapy animal visits, in light of this global situation that we're in. It was not about a year ago, almost a year ago, when we started to hear about this COVID-19 pandemic impacting us. And as we all know too well, this has greatly impacted every part of our life, and it's impacted our therapy animal visits. And so we want to talk today about making those informed decisions around resuming visits when the time comes. Might feel a little unrealistic in some pockets of the world right now, but still, we're hoping this will be a conversation that really inspires hope and gets us looking towards the future. So I see we have some friends joining. Peters and Gidget in Washington. We have Bellin from Texas, Lisa King, Dee, and Brody. So we are in good company. Thanks, guys, for letting us know you're here. I'm going to introduce our live. Please in the chat box, and at the end, I will ask them. And you're also going to see here in the chat box in just a moment a link, so that if you are one of our new networks within our network of professionals who is joining us for this broadcast today, you can join our newsletter so that you're kept in the loop about these important conversations that will help you. So without further ado, I want to first introduce Steve Dale, and then Steve is going to introduce our other guest, Dr. Golab. Steve is very popular in our Facebook community and in the pet partners world, so I know a lot of you probably already know him. He's a certified animal behavior consultant, host of 2 national radio shows, Steve Dale's Pet World and The Pet Minute, and is a special contributor at Chicago's WGN Radio, where for 23 years he's also hosted Steve Dale's Pet World. His TV appearances range from, get this, Oprah, to Good Morning America, to National Geographic Explorer, and many Animal Planet shows. He also speaks at many conferences around the world. You might have seen him at our Pet Partners Conference in 2019. Steve not only shares his expertise through speaking, but also through writing. He's contributed to and authored many books, a blog, and various other publications, in collaboration with field top leaders that you can check out online. I did want to mention, those of you who are involved in our advocacy efforts will especially appreciate that Steve is involved in many legislative efforts, from preventing breed bans to creating a law to protect animals from kennel fires. He is on the Pet Partners Human Animal Bond Advisory Board, so you can imagine how much we are benefited by having him with us. So I will pass it to you, Steve. Thank you so much for being here and for getting this conversation started.
Wow. Thank you for that introduction. You know, I drove today, but if I was taking the bus home, I'd want to go with you on the bus so you can introduce me as I walk on the bus. I want to do that introduction everywhere I go.
Yeah.
That's so nice. Thank you. Thank you. I'm not the special person here today. Dr. Gail Golab is. And I'm going to read some of this, and then I'm going to talk a little. Dr. Golab is Chief Veterinary Officer for the American Veterinary Medical Association, overseeing the association's animal and public health, animal welfare, and global outreach divisions. Previously, Dr. Golab has served as Chief Advocacy and Public Policy Officer, as Director of the Animal Welfare Division, and in a variety of other roles in the AVMA's publications, education, research, and communication divisions. Before her tenure at the AVMA, she spent several years in private companion animal practice, and prior to that, served as a biochemical, biomedical research consultant. Sounds fancy. At the National Center for Supercomputing Applications at the University of Illinois. And if you understand what that is,
prior life.
Dr. Golab is best known for more than 30 years of work in the human-animal interaction and animal welfare arena. So she is exactly the right person to do this. And I will tell you, when the pandemic hit, I called Dr. Golab and I said, I am getting inundated, and I was, with questions. Can my dog be affected? Can my cat be affected? Can my hamster be affected? And what do I do about it? And do I have to leave the house? Do I have to leave the country if my hamster gets sick? I mean, all of these questions over and over and over. And seriously, there were huge concerns specifically about cats, but huge concerns. And I made a deal with Dr. Golab. I said, I will run things by you that I write, because I knew that Dr. Golab and the AVMA were in contact with the CDC, the World Health Organization, and others, all working together. And I wanted to be a part of that, even if I was over here as a part of it, but I was still a part of it in a sense because I was providing information, I hope, rather than misinformation, because there was so much of that. So my gratitude to Dr. Golab for doing that. I've worked with Dr. Golab, who I've known for probably 30 years now. It's probably been that long, I know. And we don't always agree on everything, but I know. But you'll never ever. It's not like Democrats and Republicans right now, because you'll never ever hear me say anything other than Dr. Golab is just simply brilliant, and I am honored to not only call her brilliant, but call her a friend, far more importantly. And I'm so glad you are doing this for Pet Partners, Dr. Golab. So thank you very much, and thank you for being here.
Steve, I can't say enough about my personal relationship with you, and as supportive as you've been, and AVMA's relationship with you as well. So being able to have those conversations and being upfront about what's going on, and being able to your assistance in helping us get information out to folks is so greatly appreciated. So, and I basically just kind of like you overall. So.
I miss not having a drink with you. What was that?
I said, just as everybody on this event does. So we're all big fans. So thank you for supporting us. So appreciate it.
I thought you were saying everyone misses having a drink. That's what I thought. All right, so let's get to it, and let's get some of the. Now, some of these questions are not only questions of mine, but I'm grateful that people sent in questions in advance when they heard about me doing this. In addition, I'll get to as many of those questions as I can. But in addition to that, friends, you have an opportunity to ask questions as well. And toward the end of this, or if I see something that compelling, I will stop, or maybe Dr. Golab will stop and say, here's a question that you're asking that we want to answer. So feel free to participate. This is about your participation as well. So I think we start here. If we start to do visits again, whether they be at libraries, whether they be at schools, whether they be at hospitals, whether they be at rehabilitation centers, on and on. The list of possible places is wide-ranging. They all have something in common. There's an animal there, of course, and there's a person there as well, and you are there to help other people who are there, of course, too. How do you do this? And this is the grand question, in keeping with social distancing. Now, there is a 6-foot leash, if we're talking dogs. There's a 6-foot leash, so you have at least 6 feet. We know that much, right? But beyond that, can people, and there's a lot in this one question, for which I apologize. Can people pet the dog? Are you concerned about that dog? If it's a dog, Pet Partners, a lot more than dogs, which we'll get to. But if it's a dog, or a cat for that matter, are you concerned about that animal being a fomite? In other words, you can pet that animal and then touch your hand to your mouth, and then the disease, or any disease for that matter, can be transmitted. So can people pet the dog or cat or whatever animal it is a part of that question. There's a lot in there.
So I think it would make sense to sort of start with the big question first, which is, making that initial decision about whether or not you're going to do that visit. And obviously there are going to be some requirements around that with respect to what the facility is permitting and that kind of thing. But you should always really take a step back and figure out what the advantages are of that interaction and what you hope to achieve with that, as compared to what the risks are associated with that interaction, and whether or not it's appropriate to do that, to make that visit, or whether there may be another alternative that would work better in that particular situation. And so that's obviously going to depend upon what is going on with COVID-19 in your area. So if you have very high rates of community transmission, it just makes sense that the risks associated with exposure are going to be greater. But that brings me to your real question, Steve, which is we need to make sure that we remember that the risks of exposure are risks to exposure to other people and less about the animal. And so when you're thinking about these visits, you really want to focus on that part of it with respect to COVID-19. And so doing everything you can to maintain that 6-foot distance, making sure that you are using appropriate protections, so masks, depending upon the situation, you may even consider something like a gown, but typically a mask is probably going to be sufficient. In terms of handling the animals themselves, you basically want to just practice basic hygiene, right? That's true whether it's COVID-19 that you're concerned about or anything else that you're worried about with transmission. So making sure that you keep those therapy animals generally clean, right? I'm not talking about wiping them down with disinfectants or anything like that. That is not what you want.
Oops. Is it my computer that froze, or did Dr.
Whether
Golab?
it's yourself or others, practice hand hygiene between those interactions, right? So you don't want somebody going, you don't want that animal being touched by everybody right in a row without those people having some kind of cleaning their hands between those interactions. The other thing I think that's important to remember is that we don't have any suggestion at this point that COVID-19 or SARS-CoV-2, specifically the virus that causes it, is transmitted from animal fur. In fact, we have almost no information that viruses, period, are transmitted that way. And it has to do with the characteristics of those surfaces and what's required for that kind of transmission. So that sort of risk is actually relatively minimal. You do want to be careful, for example, about things like leashes and collars. You want to make sure you keep those clean and sanitized. But in terms of petting the animals themselves, that's not really where your greatest risk is going to be of exposure.
Okay, and I think that's important. I want to back up a step because this is the most often asked question, actually. Can my dog, can my cat get the disease that we're talking about? Can that animal be infected with the SARS coronavirus 2 that causes COVID-19?
So we do know that cats and dogs are susceptible to the virus. The good news is that if they do get infected, often they're asymptomatic. And usually if they are symptomatic, or I should say if they do show clinical signs, which would be a more appropriate terminology there, typically the infection is mild and they generally recover. And so for those few, people are familiar with reports where they talk about animals that have passed away after determined to be infected, but those events are associated with other factors that come into play with those animals and not so much with COVID-19. So yes, it is possible the animal could become infected. The good news is that if they do become infected, they're not likely to become extremely ill. And we also really don't need to worry about those animals transmitting the virus back to people. We can't say certainly that they won't because we don't have 100% information about the virus, but as far as we know, we're not aware of any situation where that's happened. And so I think that is one of the less risks that we need to worry about. That doesn't mean, however, that you want to make sure you're careful about exposing that animal to that because they can get sick. So you need to take cautions accordingly. And so you don't, for example, want individuals that have COVID-19 or that potentially that have been exposed to COVID-19 handling those animals.
And as far as cats go, there is some little bit of information indicating potentially that they can transmit it to other animals. And incidentally, other cats,
right.
Not necessarily other animals in general. And, yeah, sorry. And there was just news from San Diego Zoo and Wild Animal Park that several gorillas there, which actually surprised me that it's taken this long for non-human primates to have it. So this demonstrates to me, there are 2 points I want to make here. What a great job zoos must have done and continue to do to prevent it from happening up to this point. As far as we know, anywhere in the world, which is pretty incredible. Not that every chimpanzee, gorilla, orangutan, and bonobo has been tested. And in addition to that, it's probably not worth even bringing up here because few people watching actually go to events, hospitals, nursing homes, libraries with their pet gorilla. So forget about that whole thing. I do want to ask you about shampooing, and several people asked. So depending on the protocol of the specific organization, aside from Pet Partners broadly speaking, that some say you should shampoo the animal before the visit. How about, and you kind of touched on this in a sense, how about after the visit for the benefit of us? And several people asked about leashes, collars. Do we wipe everything down, including the bag if it's a cat or a small dog, the carrier the animal was in? Do we wipe everything down before returning back into our homes? What do you think?
So I think it's probably just to be on the safe side. It's perfectly reasonable to use good hygiene when it comes to leashes and collars and that kind of thing. So what I probably would not do is use the same leash and collar as I was moving between different facilities if I could possibly avoid it. And so try to make sure that I was switching that in that process. That's not because we think there's a huge risk with that, but it's just one of those things that you would do as a precaution. In terms of bathing the animal, I think the approach to hygiene that you use with COVID-19 is not that much different than the approach to hygiene that you would use for that animal with respect to any kind of use of that animal for pet therapy. So I don't think you need to do anything special there, but certainly you do need to be cognizant that that animal does need to be kept clean, and it does make sense that that animal is bathed on a regular schedule, right? Which I can't imagine with Pet Partners, with the quality of people that you have doing these kinds of visits, that you're going to have that particular kind of an issue. What you don't want to do is you don't want to be wiping those animals down with disinfectants. And you also don't want to be putting masks on those animals. I get that question a lot, particularly when people know that you're putting animals into a situation where potentially the exposure might be higher. They want to do that. And that is just not something that is a good idea for those animals. They don't deal with masks the same way that we do. They can be scary for them, and they can actually impede their breeding, particularly depending on what the conformation looks like. So that is not a reasonable approach for those animals.
Yeah, someone had asked me about, I think it was a pug, and they thought it was funny that the dog was wearing a mask. A braciocephalic breed, or one of those, as you said, the conformation of the dog, one of those dogs that looks like they walked into the wall, that have limited space to breathe anyway, especially if it's warm in the facility. Or if it's warm outside getting to the facility, absolutely, I'm sure you'd agree, not a good idea.
Well, and actually that makes me think of something too. One of the things that you probably don't want to do is to be having people kissing those animals, right? Or hugging them very closely. Because again, that distance makes a difference, right? So it's just like veterinarians in our offices. When we were talking with CDC about medical procedures and the potential risks associated with those, in terms of even veterinary personnel, right? If we're doing anything that involves aerosolization, so like dental procedures or anything like that, we will wear more protective gear in that kind of a situation than we would, for example, if we were giving a vaccination. And so it's a similar kind of situation here. You want the contact, but that doesn't mean that you have to have that animal right in your face, right? And so that's just not a good idea to do.
Leads perfectly into this question and similar questions. By the way, I received. So it may not be your dog we're talking about here, but it can be. You'll know what I mean, because there are so many programs where the dogs do this. So it's from Tom, who has a 6-pound Pomeranian therapy dog. Doesn't say it here, but clearly the cutest dog ever. And social distancing is difficult as everyone wants to hold and pet this dog. And there are lots of dogs who do their thing, do their work, and all they do, particularly smaller dogs, now some of them just do circus tricks, and they can do that from the other side of the room. But a lot of small dogs, and let me rephrase that, larger dogs too, all they do is jump on the bed or they sit by the side of that wheelchair, and the person's job is to pet the dog. And that's what the dog wants. More importantly, that's what the people want. That is what the dog is there for. In fact, Tom says he had a visit just 2 weeks ago. So I'm curious where Tom lives and how they manage that. Everyone used a hand sanitizer before petting the dog and after, which sounds to me like a good recommendation, but I'll let you pick it up from there, Dr. Golub.
So I think, again, here you're talking about another situation where it's about good hygiene between visits, right? So if that animal is going to be on the bed, for example, putting something disposable between that animal and the bed is always a good idea. Not so much COVID-19, because again, we're talking about primarily person-to-person transmission, but just general hygiene and other considerations associated with contact between people and animals. Having a conversation with the person that you're visiting. I mean, I think most people at this point have heard enough on the news and that kind of thing. They recognize that there are special risks at this point in time. And so just having that conversation maybe ahead of time before that animal even interacts with that person, to talk a little bit about things that are good to do and things that might not be good to do to protect themselves and to protect the animal, right? But particularly in this case, I think to protect the animal, right? So the other thing that we haven't touched upon that might be worth mentioning has to do with being thoughtful about the animals themselves when you bring them into facilities. Because if you think about this, people are wearing masks, they're wearing face shields, and quite honestly, everybody's attitudes are just really different. I was in a meeting at our headquarters office this past weekend, and we're actually working from home these days, but a few of us needed to come in. And it was strange, to be honest, because everybody was so kind of reluctant to get anywhere near each other, and responsibly so. But it just made for some really different interactions. I couldn't help but think what my own dog would have been like in that environment, because it would not have been familiar for him. So I think we have to keep that in mind as well.
So I have some questions along those lines, actually. And one is the dog's response to exactly what you said, to masking, to a scenario that's the same, but at the same time, really, really different. And several people asked about that. The good news to me is that we've gotten our dogs, this has taken a bit longer than some might have expected. So we've gotten our dogs habituated to being around people with masks. Hopefully that is the case for all of your dogs. That's a good idea. If your dog, in my opinion, I'll let you chime in on this, but I'm supposed to do the behavior questions. So if your dog is hesitant in any way about masks, first have family members put on those masks and feed the dog wearing a mask. And then out and about, people can't necessarily get that close to your dog, but neighbors, people you know, they can come within a couple feet for sure and give the dog a treat for looking at that person with a mask. That's what you want to give the dog a treat for. And acting appropriately. If the dog's barking at that person, obviously not. And then you have to do some behavior modification. But the good news is we have time to kind of practice with some of this, because for most of us, not Tom there, who I read, but for most of us, we're not ready to go back yet, or the places aren't ready to have us. So we do have time to practice some of this if you note the hesitancy in your dog. I'm curious about what you think about that, Dr. Golub.
No, I totally agree. That sort of acclimation is absolutely key. And it's better for everybody, right? Because you not only want the dog to be acclimated, but you want to make sure that the person that you're visiting also is having a good experience, whether that happens to be a patient or whether that happens to be a visit that involves providing comfort for healthcare workers within the facility. You don't want that to be any distraction that makes it any less of what a positive interaction as it could be. And again, I think, you're talking about reluctance to visit and kind of slowly coming back into this kind of thing. And again, taking opportunities to use technology. I've seen some pretty amazing information out there about what has happened around therapy visits, whether that is reading visits, whether that is visits even through windows and that kind of thing, like in some of our long-term care facilities. Really thinking about how we can use technology. I mean, there's been a lot of really challenging things about COVID-19, but the one really positive thing that it has done is that it's really forced us into the world of tech, and it provides so many opportunities to enhance what we're doing. So it doesn't take away from the in-person visit, but it provides us with other options, and it may even be options for people who otherwise wouldn't be able to have these visits for health or other associated reasons. So, I hate to keep harping on that, but I do think thinking about, risk benefit is critical, particularly when we're starting to move back into these visits. So.
My wife belongs to or participates with Rainbow Therapy Group in Chicago. And we have a little Chihuahua Terrier mix. She's 9 pounds, so little. And what she does kind of scares me, but it's wonderful. It scares me that my dog has that many outfits. She does a fashion show for kids. It's kids that she's the Children's Hospital in Chicago. And then she puts on one outfit, then another outfit. I've never known our dog had so many outfits. I think this dog has more clothes than I have. That's the part that scares me. But nevertheless, the kids love it. So there are things you can do. Having said that, to me, it's not the same as this hands-on. The dog is literally right there. There's just something different about that. I was talking about acclimating the mask. I think it was Stephen who noted in your comment there about hand washing before and using sanitizer and all of that. What I recommend people doing at home is using that sanitizer, even if you have no good reason to do it, at home, and then pet your dog. Because the people petting your dog, as we talked about, may be using hand sanitizer before and after, and dogs, of course, live by their nose. Same thing for the cats that do visits. Do you have additional recommendations for people that visit with cats, and are you somehow maybe more concerned because what we know is the receptor cells for SARS coronavirus 2 do happen to like the feline species?
Yeah. So actually the point about the hand sanitizer, Steve, is actually a really good one, because it's not just about what they see, it's about what they smell as well. And smell can actually be even more off-putting to them sometimes, depending. So that is actually a really good point. In terms of taking special precautions for cats, I don't know that I would necessarily treat them differently than I would treat other therapy animals, because again, it goes back to good hygiene overall. Because the one thing that we cannot forget is that although we're in the midst of COVID-19, it's not like all of those other potential disease issues went away, right? Because COVID-19 is here. So we need to make sure that we're considering all of those at the same time. So in terms of cats, if I did anything, again, I would probably be thinking more along the lines of avoiding the kisses and that kind of thing. Because again, I'm thinking about the risk of aerosol transmission, and I'd want to avoid anything that I possibly could associated with that. But otherwise, good hygiene. And again, for those that are doing these visits, make sure that you're not only paying attention to what's going on with that animal during the visit, but think about where you are in the facility. Because I could totally see a situation where just because you get so intent on that visit that you forget about the need for that 6-foot distance between you and other humans within that facility. So keeping that in mind as well is really important.
I think that is an important point, and that can be difficult to do at times. For example, this next question. Just curious about therapy guinea pigs and rabbits. They stay in a soft bed. The handler needs to get very close because you can't hand off the guinea pigs and run to the other side of the room. Right. So do you have any recommendations aside from masking and exactly. Self-protection, but hard to be social distancing if you have to be right there?
Yeah, I mean, there's a certain practicality involved with that. And my guess is that the facilities are going to recognize that as well. And so there may be, particularly as you start transitioning back, there may be different protocols or maybe even some restrictions around the types of animals as they bring those back. And so it may be that those animals where the people are able to do the visits with more social distancing will be allowed in first, and then eventually we'll get back to those animals where that social distancing isn't quite as possible. But yeah, like Steve, like you said, it's about making sure that you have the mask on. And I'm going to put a plug in here just because I see it all the time. It's not just about putting a mask on, it's about putting the mask on in the right way. So it doesn't do you any good if it's not covering your, I shouldn't say you, or the people around you, if it's not covering your nose, if you pull it down in the middle of a visit, or even if the mask doesn't fit properly. And so, for example, going to the grocery store, I see a number of individuals that have the mask on, but they have great gaps on the side of those masks. And so that, unless if it doesn't fit appropriately, you're not going to have the protection. And so you need to think about how you're wearing that protective gear at the same time that you're wearing it. So.
And I'm being busted here because I told a story about my wife. I know Pet Partners has a no costume rule. This is not Pet Partners organization, and it's virtual. So when things are done virtually, sometimes you have to be creative to come up with something that will interest those that are watching on the other side, rather than they have a dog just stand there and look at the camera, which isn't very exciting necessarily. One person wanted to know, when going back with these dogs, do you recommend shorter sessions, fewer sessions? So if you were going twice a week, for example, to a facility, do you go once a week? If you were going for 2 hours, do you go 1 hour? Or do you just go back like to where you were? Now, in some cases, the facility may decide all of that for you, but if that's not the case, do you have a recommendation?
So certainly with respect to COVID-19, duration of exposure is going to be a factor, because obviously the longer you're exposed to somebody who potentially has COVID-19, the more risk you have, not surprisingly, of acquiring that, right? So there may be a desire to have those visits be shorter, and partially because of that reason. But the other thing that we have to remember is that COVID-19 has really changed healthcare and how it's delivered. And quite frankly, in many cases, everything just takes longer. And so the amount of activity in those facilities and the time that they have available to do some things that maybe are not immediately required for somebody's healthcare, right? Something that is physically required, for example. Not at all to suggest the mental aspects aren't important, because they're incredibly important, but sometimes there are just physical things, right, that have to happen. And so the time required for that, they need to fit all of this into that same schedule. And so they may reduce those interactions for that reason as well. They just may not have the time available. So yeah, in terms of minimizing risk, the less time that you're in there. The other thing is too, is it may be worthwhile having a discussion with the facility about how they are managing things like testing in the facility. So for example, my mother right now is in a long-term care facility, and in that particular facility, they test their staff every week. And depending upon the results of those tests, they then go in and they test their patients. And then they report back to the families what the results of those tests are every single week. So they have sort of a, it's a collective report, right? So, and they can't, it's not like they're going to identify this patient has COVID. But having some of that information, or having those kinds of conversations with the facilities, is not a bad idea either, because that also gives you an idea of whatever your personal risk will be, particularly in those areas where community transmission is high. And so I'm being very cognizant of that.
The hope is, as you know, I had an opportunity to talk to Dr. Anthony Fauci just a couple days ago. And he really does believe that within a few months, we'll see, there will be, you can go to Walgreens or CVS and get a test for yourself. If that's the case, presuming that test is available and inexpensive and reasonably accurate, not as accurate as he says, it won't be as accurate as the PCR testing that is like the top of the line testing, but it has a good degree of accuracy. Do you recommend that before people, and this may be a broader recommendation, before you go to the theater, before you go to sporting events, before you go anywhere, that you go to a local drugstore, pick up a test, and get tested? Would you recommend such testing if it's available before these visits?
So I don't think that's a bad thing to do at all. And I think certainly it would help facilities be more comfortable about supporting these kinds of visits. The only reason I'm hesitating at all is because just with some of the challenges that we have right now in terms of processing tests and that kind of thing, there's just like there's a desire to make sure that everybody gets tested, but then there's also a realization of what the resources are that are available. So we always have to kind of keep that in mind as well, because just like with vaccination, with the way vaccines are rolling out, it's a question of trying to determine who is at the most risk, and potentially who delivers isn't the right word, but you know what I'm thinking about, the most risk, right? And so the people that you come into contact with, who do you want to protect as well? So that's a consideration for both of those. But yeah, being tested is always a positive thing. It gives us a good idea all the way around. We just need to be thoughtful about how we're using those resources when we're considering doing that.
Sure. You know, I'm just thinking that I'm going back in time, even just 10 years ago, and certainly 20 years ago. You had to show that your dog, which is one of the reasons, there are many, why Pet Partners is top of the line. Pet Partners was very good at doing this and still is, showing that the dog, or whatever animal it is, has the appropriate temperament to go into that kind of facility. Maybe now it's not only about the animal's temperament, but it's about our health and proving that we are healthy enough and will not pose a risk to others. So I think, you know, that my hope is that such testing is available. And I think if it is, it'll maybe even for at least a time become part of our culture. I wonder if proof of vaccination, Dr. Golab, I'm talking about our vaccinations, would also help.
Yeah, I mean, I think all of those things, anything that suggests to the facility that you're trying to be as responsible as possible is going to be helpful. So I think all of those things are. One thing that this question that this does bring up, though, and we're still getting these questions, and that's about testing the animals themselves. And we still are not recommending general testing for those animals, only testing in certain conditions where essentially the short version of that is we're reasonably sure that there has been exposure and that we have an animal that is currently showing signs that would be consistent with the infection. Otherwise, by and large, with some other special exceptions, for example, research and that kind of thing, we're not recommending testing. So whereas it does make a little more sense on the human side, that probably isn't something you want to integrate into a protocol on the animal side of the equation.
All right, so before we lose time or run out of time, I absolutely need to ask you the big question. And that is, how do you know the dog is ready to go back? Has the dog forgotten how, I keep saying dog, but it can be another animal as well, of course. And how do you know that companion animal hasn't forgotten how to do all this stuff? How do you know that dog will be now accepting? And also for older animals, that dog that was kind of, you know, teetering a little bit, maybe 13 years old. Well, that dog's now over 14 years old. So how do you navigate all that? And you might be ready to go back. The facility might be ready to have you go back, but that animal, whether it be a guinea pig or a dog or a miniature horse, may not be ready.
Right. Exactly. I think that is a hugely important point. And I think that also goes together with if you are in a situation where you have brought the animal back for a visit and the animal is obviously not comfortable, you know, the visit needs to end and you need to go back and figure out why that's the case and then do whatever corrective training might be required, acclimation, whatever that happens to be, in order to get that animal comfortable again. But you never want to be in a position where you're forcing that visit because that makes things difficult for the animal. And sometimes the animals act unpredictably, as we all know, when you put them in situations like that. So you don't want that to happen either. So
Yeah, I would say, uh, many people may be nervous about going back, understandably. So try not to be. Try to be excited. So the dog picks up on that emotion rather than you're being very, very worried about it. Because again, I said dogs, but all our companion animals pick up on our emotions. Dogs are particularly adept at it, of course. So that would be one thing. And then try to practice. Now how do you practice? So if things are open up where you can go back somewhere, then they're opened up enough to visit grandma, I assume, or someone that it may be a scaled down, completely different version, but at least they're seeing a wheelchair, or maybe take them to a dog park so they're with or some other place where they're with other people. The idea is to kind of get them in the groove the best you can, in a way that you think you can do it. I don't know if Pet Partners is going to mandate retesting or at what point in time that will happen. Some of these organizations might. And that could be a concern too, as well, if the retesting is inside and the COVID issue about being inside. If the testing is outside, that might not be a bad idea, or a refresher dog training course. And that could be fun, again, as long as it's done safely. I mean, those are my ideas for all of this. But the most important point actually is the point you made. And that is, if you sense that your animal is stressed in some way, say, all right, enough's enough. You've been wonderful. It's not you. It's maybe not me, but it's my animal's having some issues here, my dog, cat, whatever. And we're going to go home and, as you said, try to work it out, try to figure out what it is. And if it's an older animal that hasn't done this in a year, it might be more likely that there is a problem. And the problem is our egos sometimes get in the way because we want to do this so badly. So really try to be observant of what your animal is truly doing. And that's, I'll tell you, that may be the hardest thing to do, Dr. Golab, because it's our own animal.
Yeah, and I want to take a moment too. I'm so excited to be hearing this conversation and learning so much, but also just for all of our handlers on here, seeing how much this conversation validates even the things that we were doing as handlers before this ever hit. Really high standards of practice around infection prevention. We are always committed to being our animal's best advocate, to reevaluation, COVID or not, to advocating for our animal. And so you have the tools. If you are a Pet Partners team, or if you're a therapy animal team that belongs to an organization with those high standards of practice, you have the tools to advocate for your animal, and to make sure that they're really enjoying what they're doing. I do want to mention, Steve, a question around behavior came up a while back, and I wanted to get your take on this before we run out of time, but it was mentioned, mask. If you're like me, when I try to go to the grocery store, I have a hard time understanding what people are saying to me when they have a mask on. And we had the comment that the animals are sometimes having a harder time following our cues and our directions when we have those masks on. So do you have any tips around that, assuming masks will probably be in our future for a while now?
I love that question. I went down to, I'm at the studio now on the second floor, went down to Potbelly's for lunch. And as I'm paying for my chili, by the way, their chili there is really pretty good. And I'm paying for the chili, and the lady says to me, she had a mask on, and I said, pardon me? She said, I said, okay. I still don't know exactly what she said. Something about being on the block. I don't even know what that means. So yes, we're having a problem. Our dogs may well have a problem or not. So I've always been an advocate of whatever you're teaching your dog, use physical cues to show your dog what you want. This may be, I love your question, by the way. This may be a good time. I'm bored. I don't know what to do with my dog. This may be a great time to do exactly that. So sitting down, I can only do certain. So come is like this, right? We learned that in 101 of dog training. The dogs are really more interested in this, unless they're 6 rooms away, but they're interested in this more than the word that you say. It's amazing that dogs, as I was talking about geriatric dogs, as they lose their hearing, they are still able easily to follow those cues if we've taught them those cues. So yes, dogs can learn, several hundred words. And I would argue that if we up to 300 words, 265, I think is the number on average. But if we continue to talk to our dogs, they can learn many more words, but they can learn as many signals. I don't know if we can come up with 300. I feel like a third base baseball coach. What do you I don't know. But for the very basic cues, our dogs, and if you think about it, they understand more than we know even. So how many of you actually, I won't tell anyone, your dog shares your bed. And at night, you may go, woof, or something like that, whatever. The dog knows when you go like that, that means, or you're pointing at the bed, jump in the bed. They pick up on these things really more easily than the spoken word. And you are right. That's such a good question, because understanding through the can be difficult for us. It's going to be difficult for dogs. I don't have as much of an answer for cats, but we don't necessarily have them do as many things, except look just really beautiful as they're there. And someone brought up, I want to say this because it was an excellent comment, to have, if you at all think, and again, the facility may decide this for you, but if you at all think your dog may be concerned, start with a 10-minute visit. Unheard of. But if you can, do it, and try to make it as enjoyable for the dog or whatever animal it is as possible. And then the next time, 20 minutes. And then the next time, if all is going well, your typical 60 minutes, if that's what it is.
Yeah. That's a wonderful idea. And doing those things that we did when we first got into this field, monitoring your animal after the visit. What is that recovery like? And sometimes too, it is, I've learned through work with my animals, it's not just about the new setting with new equipment. It's that we have a larger burden on us now. We are all more stressed now than we were last year, probably. So it's a different environment to respond to. I like that we've had a few comments too about this really creative alternative to therapy animal visits. And of course, it's not going to replace being with an animal and that human animal interaction in person, but we've seen really powerful testimonies from animal related engagement, which we're encouraging our teams with virtual visits, reading about animals, learning about animals, getting back into that kind of humane education idea. We did have the question about window visits being safe. So Dr. Golab, can you comment on that, as a safe way to still let people know that we're thinking about them and we would be with them if we could?
Yeah, I mean, window visits are certainly a good option. Talking about window visits, though, you need to make a distinction between window as in glass window type visits and screen window visits, which don't have the same level of protection. And I know actually there's some discussion around that at my mother's facility as well, because they were originally thinking they were going to do these screen window visits, and they actually eventually backed off and decided they needed that visit. You raised a really important point, though, that occurred to me. One of the values of these human-animal interactions is not just the interaction with the animal, but it's the connection between the patient or the healthcare provider and the handler as well as intermediary. And so I think we can't forget the value of that human-human interaction, even if that interaction is through a glass window. So even if there are some impacts on the ability of the person to actually touch the animal and that kind of thing, having that animal be the intermediary and still being able to have that person-to-person interaction provides huge value. And so I think we need to make sure that we don't forget about that piece of it.
Absolutely. Absolutely. Well, I do see we are coming to the end of our time, and
you don't want me to read the question. What do I do about my bird that swears at people?
Oh, I hadn't seen that one yet. Do you have a fix, a quick fix for us? Go ahead.
Yeah, don't bring the bird anywhere in public, is what I say. Actually, that happened to me once. I was at I was at the Lincoln Park Zoo at the time, and I had a bird that was donated, and we thought it was donated by a lovely little old lady who had passed away, who went to opera, and the bird sang Italian opera and really did a very good job at it. And then one day at a visit, luckily it wasn't me, the bird let loose with language that, boy, oh boy, this lady had quite a toilet mouth apparently. and we took the bird off exhibit, or the zoo did at the time for obvious reasons, away from the public, and wasn't going to public visits anymore. This bird was still well taken care of. I'm not a citizen, a parrot expert, but it has been suggested by teaching these birds other words and not using that word in time, it goes away. But that's beyond my expertise. I just thought it was a question that I had not seen before.
Yeah,
here.
that was a good question. Absolutely. We've had a lot of great interaction today. Thank everyone so much for your questions. And again, we know in some ways, I was thinking this morning when we first started talking about this Facebook Live, we had such high hopes that by January 12th, we would be farther along in this COVID journey, that we would be able to resume visiting. And I know it's not realistic for a lot of people now. And at the same time, there are some facilities that are managing to find some safe ways to do it, realizing we have a mental health crisis upon us at this point. And so just walking that line, looking at the benefits, looking at the risk, and we hope this conversation just gave you some considerations to help outweigh the pros and the cons when it comes your time to decide about revisiting. Do want to make sure everyone's aware at the end of this month, we'll have another Facebook Live with a hospital therapy dog coordinator who has figured out some ways to work with her veterinary staff and in a very limited way bring back some therapy animal intervention. So that will be a good kind of case study to learn from. Also wanted to make sure that everyone who is joining us today, I hope that you're enjoying these series and that you stay tuned. If you have recommendations for what you'd like to hear from us in the future, please put them in the chat. And if you are in the group of professionals who's watching this today, whether you're a professional mental health provider, thank you for all that you do right now, especially in this climate that we're in. If you are a facility leader, we have a series just for you. We have information just for you. So sign up for our AAI for Professionals newsletter that will be in this chat box. So any final words from you guys? Thank you so much for this information today. This has really, really been helpful.
Well, I'm honored to appear on stage, even if it's a virtual stage with Dr. Golab. Are you guys putting this on YouTube or somewhere else at some point? You may want to mention that.
Yep, we sure will. All of our Facebook Lives are recorded and they're available on YouTube. So we will have that link made available and you can share it with anyone who you think could be benefited by this information.
And from my perspective, I think I mostly just wanted to say thank you. You guys do some amazing work and it's very much appreciated by a lot of people. So thank you for that. And I appreciate the opportunity to be here today. And I would be remiss if I didn't say it, but don't forget the veterinary care for your partners there. So incredibly important. So
yeah, I think veterinarians. So I want to take 30 seconds to say this. So there was early on in the pandemic, all the networks carried a concert. I don't remember what the name of that event was, but it was on CBS, NBC, and ABC. And they had all these performers singing. And between that, they had actors speaking. And at one point, they had Laura Bush on and Michelle Obama. And Michelle Obama looked into the camera and said, "I want to thank all the first responders." And then she turned and Laura Bush said, on the other side of the split screen, "I want to thank first the veterinarians." And she is absolutely right. Veterinarians have been right out there, first responders in a sense, in all of this, taking care of our best friends. And I'm grateful for them and veterinary technicians. I'm sure had she thought of it, Laura Bush would have mentioned veterinary technicians as well. So to all veterinarians and technicians, I want to say thank you very much.
Yeah, we could not do our jobs without them. So thank goodness for them.
Yes, during these very challenging times, we're seeing who the helpers are and seeing who we just can't live without. So much gratitude. Thank you guys for being here. And we will continue to be in touch with more Facebook Lives in the future.
Sounds great.